Hidden culprits of poor oral health. Mouth breathing leads to dry lip, snoring, open mouth posture. Tongue thrust causes tongue pushing forward while speaking or swallowing. Nutritional deficiencies. Signs: weak enamel, bleeding gums, low vitamin D, calcium, misaligned bite. Results in jaw pain, headaches, uneven tooth wear. Sleep disordered breathing shows as snoring, teeth grinding, restless sleep, silent acid, reflux, GERD. Symptoms: sour breath, enamel loss, throat clearing. Dehydration manifests as sticky saliva, dry mouth, low water intake. Poor oral posture includes mouth open at rest, tongue not on the palate. Don't ignore these red flags. Visit to oral myofunctional therapist and dental sleep specialist.